Hello everyone, I am Manav Gupta, currently a first year radiology resident at Maulana Azad Medical College, New Delhi, and I got a rank of 111 in NEET PG 2024 and a rank of 14 in INI-CET November 2024. So, I have been also through this kind of a preparatory phase like you guys are currently in. So, today I'm going to share some few tips and strategies which I used to follow, which I didn't used to follow at my preparation time, so that you guys get a basic idea of how to prepare and how to cover these last 3 months effectively and get a good rank. So I'll be covering two topics, which includes MCQs and revision. So MCQs, the first question which usually arises in each and everyone's mind is how many MCQs to practice. So it's not a definite number of how many MCQs you should practice, but at least 50 to 100 MCQs daily you should practice at least this. More than that is also good and beneficial, but at least 50, which should include mainly PYQs and secondly a mixed bag custom module. So for PYQs, Cerebellum is posting daily 2 PYQ mini test, one in the morning and one in the evening, which includes PYQs from the recent NEET, INI and FMGE exams. So giving these 2 mini tests will cover more or less all of the PYQs if you give these tests daily and assess yourself for the next 3 months, and your PYQ part will be covered. So PYQs are not to be taken as PYQs only, but to be taken as PYQ topics. The question should not be exactly remembered like that, but the topic with the explanation which is given beneath the question should be remembered, because the question, the examiner can change or form the question in a different manner, which could be given in the next exam. Not exactly the same question will be copied, but it will be copied in a different manner. And another thing is, another question bank could include a custom module. A custom module means a mixed bag custom modules which include questions from each and every topic, so that it simulates you, it trains your brain to do anatomy question once, and then do a physiology question once, and then do directly a medicine question once. So doing custom modules daily will make your brain to habit of solving a question from anatomy from a first year subject to medicine, which is a final year subject, which actually happens in the real exam. So doing these 2 PYQ tests, one in the morning, one in the evening, which are posted daily by the Cerebellum, and a mixed bag question bank in the evening or whenever you get time, it will more or less cover the MCQs which you require to do daily. Also try to do the MCQ in a stipulated time only, don't hurry through them or don't overthink them. Basically try to do it in a time frame of 40 to 45 seconds, which is the time frame in the final exam, and try to cover each and MCQ in this time frame only. Don't try to overthink about it. Don't try to hurry it fast, because overthinking and doing the fast thing can get you the question wrong. So doing custom modules of questions other than PYQs is a good idea, of not restricting yourself only to the PYQs, because PYQs constitute only 50-60% part of the main exam, and rest 40% are new MCQs. So you need to practice that as well. Also, don't do MCQs just for the sake of doing it. Try to take each and every MCQs as a challenge, as a new question. Even if it is a PYQ, don't think of it as a PYQ and try to remember the answer. Yes, it was this answer which I marked while doing the PYQ. Try to take it as a new question. Try to rule out options. Ruling out options is way easier than ruling in options. Try to read each and every option and try to correlate whether it correlates with the given clinical stem or with the given clinical fact or not, and try to rule out, because ruling out more or less rules out 2 options every time, and there is confusion between 2 options where your knowledge comes into play. Read each and every question as a new question and don't overthink about it. Now talking about the revision notes after the MCQ part. So revision notes, basically for someone who has been through the main notes 2 or 3 times in the preparation phase, should now start doing revision notes mainly, because now in the last 3 months going again through the main notes is not a good idea, especially for subjects for which he thinks he has a strong hold on. He or she should start reading the revision notes only. Reading main notes again and again will unnecessarily waste time, and you will not really gain anything important from it. So revision note strategy should be covering each and every subject based on the length of subject. For example, medicine, surgery are long subjects, so giving 4 or 5 days to the revision notes is good. 4 or 5 days or even 7-8 days will work. For smaller subjects like FMT, anesthesia and all, 2-3 days are enough. So preparing your schedule in that way, so that you revise each and every subject based on the length or amount of information each and every subject have, and creating a spaced revision schedule. Spaced revision means if you are doing medicine right now, and after a certain interval of time, 3 or 4 weeks, in 3 months you can do 2 spaced revision. After 3 or 4 weeks or 4 or 5 weeks, you can again do medicine, and so that the knowledge of your particular subject gets consolidated again and again so that you can remember each and everything at the time of your exam. And for someone who has started his or her preparation recently, should also go through the revision notes right now, because if he or she goes through the main notes right now, it will contain so much of information that it's not like humanly possible to remember in such short span of time. And revision notes more or less has like content which is usually asked in each and every exam. 70 to 80% content is covered in the revision notes, and hence the preferred strategy for both who have like went through the main notes many times and who have not went through the main notes even once is to go through the revision notes right now in the last 3 months and not to look at the main notes if they have a strong hold on the subject. And for someone who started his or her profession recently and has not been through main notes once, should also start reading revision notes, because revision notes contain contents which makes up for the like 60 to 70% of your questions asked in your exams. And hence doing the main notes will more or less guarantee that you are familiar with approx 60-70% of the questions that are going to come in your exam. And revising main notes repeatedly for these 3 months will help you like cover more or less the like around 150-160 questions which are asked there in your exam. So for this, Cerebellum has started a lab 2 in which they cover each and every subject in a short span of time, in like 3-4 days. For example, pharma is covered in 80 hours, and similarly by Dr. Jiaji. And similarly, each and every subject is like the revision note part or the revision part, not the main content, but the revision content is covered in this lab 2 revision, for which they are conducting live session. Like at the end moment, it is difficult to study on your own, like studying notes gets monotonous. So like if someone is teaching you, it is like a fun activity and you get engaged daily. This lab 2 revision is going on for NEET PG, and each and every faculty is trying to cover the important questions, the important content for the last 3 months of their exam in a short span of time, so that you cover each and every subject before your exam. And another initiative which Cerebellum is taking is like to start a marathon, in which for the last 1-2 weeks they start basically another small revision program which mainly covers the high yield points, even crisper than the revision, this lab 2 program, which mainly contains the PYQs and all the important high yield questions, one-liner questions, where each and every faculty will come for a live class and try to cover the important topics, the important questions which are usually asked in the like previous year questions, so that like in the last 4 or 5 days the volatile topics, each and everything is covered and you get to remember them at the day of your exam. I personally feel like doing like what I personally did was to start my rapid revision notes or whatever from wherever source I did the revision notes like around 2 months before. I started reading revision notes daily, and like I practiced MCQs around 150 MCQs, 150 MCQs daily, which included like more or less 70-80 PYQs and rest 50-70 custom mixed bag question. And this technique mainly, like I have given 3 exams, one INI May, one NEET PG and one INI November. So for INI May, what I used to do was like to read main notes daily before 1-2 months as well. I used to do like read main notes daily and didn't give much like thought to doing MCQs that time. So what that created in my mind was such a like so much bulk of information which was useless and was like literally not needed at that time, and hence I got fumbled during the time of the exam, didn't remember important questions, important facts, important tables, and like remembered useless information which was not required at that time, and I fumbled a lot and I did many questions wrong at that time. And hence I recommend in these last 3 months not to go after the main notes. Try it like for which subjects which you feel like you want to read a specific topic or subjects which are weak, you can go to the main notes, but not for all each and every 19 subjects, because it's gonna consume a lot of your time and you have very less time left. So for these last 3 months, try to cover rapid revision notes, this lab 2 from Cerebellum, marathon which Cerebellum will take just before the exam, and these PYQ, like the 2 sessions which PYQ live sessions which Cerebellum conduct, you should attempt them, analyze them and see which subjects you are getting wrong and try to work upon them. This is the like more or less the best strategy which you need to cover, and try to like follow this. I know like most of the people it is tough to follow this rigid schedule, but even if you follow 70 to 80% of it, I'll know you'll more or less get over the bar. And one more thing is like try to use your flashcards, your mnemonics, whatever you have made throughout these 5.5 years of your MBBS, your internship, try to use them, because more or less they are in your subconscious mind, because you've written them on your own, you have made them on your own. Try to use flashcards, try to use mnemonics, try to remember them, try to go after them, like stick it on your walls and try to read them daily, the important questions, the important diagrams, anatomy diagrams, because anatomy is asked a lot In our NEET PG 2024, they've asked so many image-based questions, so many from surgery, like cancer staging as well, they asked image-based question, and a lot. So try to go through images, flashcards, mnemonics, and try to like see a few images, a few topics daily. And also one more thing which is important in this time is to avoid burnout. Like a big mistake which I personally did, was I used to read daily for 10-12 hours, daily continuously, having a little 5-minute break in between, daily continuously, avoiding time, like spending time with my parents, with my friends, talking with them. So like try to avoid burnout. Talk with your friends daily for 5-10 minutes, sit with your family, talk with them, ask what's going on daily for about 15-20 minutes at least. Try to go for a walk daily for 30 minutes, 25-30 minutes. Try to do yoga daily 25-30 minutes, whatever you like. Try to spend time around an hour or 2 hours aside from studying and sleeping, please. Because burnout will actually spoil each and every bit of knowledge which you have had in your mind, and it will spoil each and every, like all the hard work which you have been through in this last 5.5 years. So try to avoid burnout, try to enjoy life as well. These 3 months are like only a small phase of your life. It will also pass and you will definitely score a good rank in your exam. Thank you.